Hi guys, how are you? We're just wrapping up an under treatment for our lovely patient here for her skin laxity and general loose skin after delivery of a baby. So you can see the patient was very happy that even after one under treatment, the belly button area has really tightened and the general laxity of the stomach has improved quite a bit. So now that we have done the under treatment for the skin laxity and the general loose skin and the belly button area, we are gonna do something really cool now. We're gonna use our CO2 laser, which is the gold standard in terms of lasers, to treat her stretch marks. Very few lasers have the power, the technology and the intensity to treat stretch marks. My advice is come in early when you've had the stretch marks, and when they're nice and pink, nice and red, that's when you can really fast track the process. Okay? Could you pass me the wipes behind you, please? One of you. Thank you. How are you feeling, darling? You're okay? Perfect. Just feel free to ask any questions you have as well, okay?
So how many sessions of under have you had?
She's had one session already, and she herself, her exact words were, "It's already working."
Okay.
Big difference around the belly button area, and general skin around the abdomen area has tightened quite a bit. And I always like it when compliments of a treatment come unprovoked. So if this is a scenario, feel free to disagree. The patient brought it up themselves that it's already working even after one treatment. Can I get one more, please? Which is our gold standard. Patients should be in the waiting room with a big smile, be like, "Hey, it's working." If I don't hear that, that means I've let you down.
So if I have a stretch mark appear, how soon should I come in and get it treated?
As soon as it has occurred is better, but
Okay.
still you will get a result even if you come in later, because the technology is very robust. It's just that it shrinks like, really quickly if you come in early. But I've seen stretch marks, laxity just heal like nothing else. Same with acne scars. The technology is so superior that it's almost like the skin just comes up from those pitted acne scars and they get filled out. And it's so interesting. If you want to look at the machine, there is 3 different settings in terms of the mode. What we're using is called a smart pulse today. For really deep acne scars and old stretch marks, old surgical scars, we use a setting called deep pulse instead of smart pulse. That gives me a lot more power that I can manage. So it's just pressing a button. You can see it's in SP, which is called smart pulse. Now, this is the same settings I would do if it was your face, neck, décolletage as well. But today we're going to show this treatment on the abdominal region with regards to stretch marks. Okay? Good to go, darling?
Yeah.
The technology is imported from Italy from a company called Deca. Coincidentally, it's a machine. A lot of other lasers are made by the same company. So it's a parent company, so it's very high technology. Okay. So, darling, I'm just going to start the laser treatment. Okay?
Is this the first laser treatment after
For
the-
her,
Yeah,
yes.
wonderful.
Absolutely. It's good that I have, what's the word, ambidextrous. I can use both my feet.
Both your
To fly a
hands?
plane, you
Oh.
need to use both your feet. You
Ah.
can't use one feet. I remember 7 years ago, to get used to that, I started driving a car with 2 feet.
Oh my gosh.
It's good. I'm talking about the foot pedal, by the way.
Yeah.
Alright, darling, just relax. Any questions, just ask me.
Yep.
We'll just start nice and easy here, okay? 100%, that's good. Just give me an idea. 1, 2, 3. Is that okay? Not too bad, isn't it? It's good anesthesia. Is that okay for you?
Yep.
Good. Not too bad at all?
Good.
Good. With our lovely patient here, we read the pinkness in her cheeks to tell if she's comfortable or not. Okay? Any questions, team?
So with this treatment,
Yeah.
will I see reduced redness from the stretch mark as well as the skin pulling back together?
Yes, you'll see both.
Okay. How many treatments do you recommend?
So I personally think a combination treatment of Onda and CO2 laser, 3 treatments, you will get a outstanding result. We don't like wishy-washy average results. We like big results here, you know, big positive results. So you can see it's nice and red, eh? You can see that you will notice the stretch marks just contract even after one session.
And how long does it stay red for, and what's the downtime?
Because of the CO2 laser, you know, I say it's a dragon, isn't it? It's a strong treatment with big results. Probably 3 days is the redness. There may be just localized swelling in those 3 days, and after that it'll just settle down. Sometimes the redness can be there maximum because we are doing it at a dot setting, not a cool peel setting. You okay, darling?
Yeah.
It may last up to 5 days as a maximum. If when we do it at a cool peel setting, just 2 days, girls.
And is there anything the client will have to do afterwards to treat her skin?
Just moisturize and tell everyone how nice we are. Only 2 things. That's what I mean. And even if you don't moisturize, you will still get an outstanding result. The only reason I encourage moisturizing is the skin will, you know, the micro scabs which form, they just come off much more easily. Hey, I'm so excited for her result. Hey, if just Onda did that, you know,
Yeah.
can you believe what Onda and CO2 will do?
It looks like a very comfortable procedure, like the patient's not in any
No, she's just
discomfort.
relaxing.
Yeah. So when are we getting Netflix in here?
When are we getting Netflix?
Now you need something to watch on the ceiling.
You can watch my face. I'm just kidding. I'm kidding. You
I
can
think
watch my Captain's Mole. I have a name for it. It's called Captain's Mole.
Stunning.
It's helping me age gracefully.
It's helping?
Because I like to think I'm still 29. I
Are
have
you?
issues with aging, but I'm actually, you know, so this is like, you know, a way of aging.
Makes
gracefully.
you happy to be
Yeah,
aging
makes me
gracefully.
happy to acknowledge my age. You okay, darling?
Yep.
Looking good.
How's it feeling? Can you feel anything?
I can feel it for sure.
Yeah.
I wouldn't even know how to describe it.
Just to see the hot, maybe hot.
No, to be completely honest, I got
Yes.
a tattoo. It feels kind of like that.
Sure.
But it's the second it's stopped,
Yeah,
there's no pain or anything.
that's it. Exactly. What we can do as well, darling, Olivia, if you wanna just grab a ice pack from the fridge.
Next one?
Yeah, in the treatment area.
Okay.
So that way the area which is done, you can put an ice pack straight away.
Yep.
Just to cool it. That's
Yep.
it. Eh?
Yeah, where you started
That's
up
it.
here, it's a bit hot.
That's it.
But it's not painful.
Exactly. So we're gonna cool it straight away. Okay? And ice packs are your friend.
Yeah.
Okay? You feel free to use them. There's no contraindication. Use them as much as you need. Okay? Yeah, the whole thing is going to contract. I am so excited. Because you know why I can tell? Already they've become nice and red. And they are contracting. You know, you can see they're nice and red already. That means the collagen, the elastin, the fibroblasts, they're all getting kick-started. And they will just shrink.
Yep.
Okay? Comes to the belly button at the end. Got it?
Yeah. It's quite hard, she said, to just
Okay.
Can we read?
Yeah. So what we generally do, it's just an ice pack, darling.
Yep.
Okay. They have blue ones too, darling.
I think they're out.
Okay. Oh,
Yeah.
good. That's fine. Eh?
She's like, I have to go find you one.
That's okay. Cool. Did you need anything at all? Yeah. They're pretty quick treatment. We've covered the entire abdomen area in almost 10 minutes.
I can't remember if we answered this question, but how soon after having a baby can
Yeah.
you get this procedure done?
On the abdomen, you can probably do it within weeks to a month.
Yeah,
We
okay.
generally don't do the face while you're breastfeeding because the hormones are still quite high, and that can lead to hyperpigmentation. Whereas, I would say that's the only thing we are a bit careful about is breastfeeding.
Sure,
So you can do it as quickly as you want,
sure. But the breastfeeding doesn't affect.
No, it's it's very less likely.
Sure.
It's all about hyperpigmentation, really.
Yeah.
So if you are doing it while breastfeeding, the hormones are quite high.
Yeah.
It can trigger things like melasma, etc. And on the abdomen, very, very unlikely. Okay. So CO2 lasers, in my honest opinion, are the gold standard. It's a lot of power and skill that you need to wield it with the respect that it deserves. That's the main thing. Now again, if we were doing the same treatment on your face, I would ask you to take antivirals, such as a cold sore tablets, acyclovir, famciclovir, or something like that, just to prevent a breakout. That's all. If you're prone to them. And we use a very strong topical anesthetic as well, such as we call it Fraxel. It's 23/7, sort of much more stronger than Emla. So patients are very, very comfortable. Is the cool pack helping, darling?
Yeah.
Yeah. Cool. I'm getting personalized cool packs done. So every patient who has this will get one home.
That is fun.
Yeah.
It's all about the experience here.
Also, it's very simple. Like, there's not 10 things you need to do when you go home. Literally, just for comfort is a cool pack.
Absolutely.
Okay, darling? That's
Yeah.
nice and nice. It's a nice feeling, isn't it?
We also wanted to mention that if anyone is watching and they have any questions, please feel free to ask any questions and we can answer them live.
You can buy a simple cool pack if you already don't have it at home at Chemist Warehouse or anything, eh? It just helps.
Yeah.
Symptom management, that's all. Some people prefer a 100% aloe vera cream. And for patients who've had cool peel with me in the past, this is an upgrade from cool peel, but also the downtime is longer. So one dot therapy, which we're doing on the abdomen, which we can do on the face as well, is equal to 3 cool peel sessions. But you will have a proper 3-day downtime and depends on your work life, 2 more days of redness with a dot. So if you're someone who wanted to do maintenance and can take the downtime, you can get away with 1 dot therapy instead of 3 cool peels. Almost done, darling. Little bit now. When you get it done on the abdomen, I suppose the good part is it's not like you are exposing that area, so you can carry on with your life, Panadol, Nurofen for discomfort, Just don't go swimming next 3 days. So that's generally what I would suggest, darling. I'm just gonna cover the rest of it as well with the ice pack for you. Okay? Just gonna check if there's any little bit that are getting away. Yeah. Pretty good, I would say. Good coverage. I've covered it till the line that they extend. Okay? Just gonna give you a little bit of coverage in the borders. Okay?
Yeah.
Still comfortable?
Yeah.
So my patient's pink cheeks meter is reading accurately. She's not in any discomfort, you know. So ice packs, Panadol, Nurofen, you know, simple things. It'll
Yep.
settle very quickly. But think about it. You want to change the tide of what, you know, stretch marks, laxity and age has done. So you need a robust treatment. Like if I just did something gentle, it just won't work, you know. So that's why I'd rather do something substantial, explain and enjoy those 3 days downtime and then get a big result. Right?
Yeah.
Makes sense, darling? Perfect. But no, patient was very happy just with Onda itself. So this is gonna really sandwich the loose skin. You've got Onda coming in from underneath and CO2 laser coming in from the top, right? Do I look a bit funny with all my poses and
I
clothes?
never noticed until you said
I
that.
know.
Yeah.
Sometimes I feel like,
Octopus man.
No.
I don't know.
ah,
They're attached to a monster.
I was hoping someone will say both Han Solo and Indiana Jones, but
I mean-
fine, I'm Octopus Man.
I think I was so far from Han Solo.
Why can't I be Han Solo?
You could just be Octopus man.
Much more accurate.
Story of my life, right? No. Perfect. Literally, that's all done, darling.
Yeah.
All done. Girls, you happy? Any more questions?
No, that's all. I got
Okay.
some great photos.
Yeah, that's good.
Beautiful.
No, I'm really pleased with Onda. It's just something so simple, but it's been giving big results. At our North clinic, we've had a lady who had a baby, lots of loose skin, a lot of irregularity in the abdomen region, like really bulging abdomen region. She lost 6 kilos, flat tummy, belly button just tightened, and the stretch marks almost gone. This is your friend.
Oh,
Don't say
how's
the
it
name.
name?
I know, I know. I know.
That's
know.
amazing.
I know. Pretty cool. Right?
Yeah.
And so Onda is
so
working
nice.
exceptionally well
Oh, wow.
for arms. It's working exceptionally well for bra fat region, chin and abdomen. Those are regions we are seeing results even after one treatment.
Oh, that's so good.
Wow.
There you go.
So exciting when you see
Yeah.
results straight
One
away.
treatment, that's
Well,
our
I
goal.
did
So
Onda
satisfying.
on my chin,
Chin, I know.
and that I lost like a centimeter
That's it.
on that in one go.
Our
Mm.
policy is that, hey, one treatment. If you're not seeing a treatment, if you're not
A
seeing a result
result.
in one treatment, I just don't take the patient on as, because
Yeah.
I'm generally restless for results. So
Mm.
one treatment, you need to see something.
The patient so agrees with you. She's like,
Literally.
yeah, you're obsessed with results.
I am a bit, yeah.
Yeah.
Impatience is
It's
my
his
power.
quirk.
That's it. Yeah. All good, eh? Thank you.
Beautiful.
Thank
Thank
you.
you.